very good morning to all my seniors. Myself, Dr. Kiran Dhole. So this paper is about a novel entry point in transforaminal endoscopic spine surgery called as PL-TOSP. So transforaminal endoscopic spine surgery provides a minimally invasive access through the posterolateral safe zone as given by Cummins.
Just pause a little bit. Picture is gone. Okay.
But the crux of the surgery is to have a precise needle trajectory. Thus, the optimization of the skin entry point plays utmost role. So there are 4 entry points described in the literature, namely 45-45, posterolateral, tip of spinous process, and dorsum of facet joint. But the ideal skin entry point is the one who provides a trajectory to the herniated fragment without entering the peritoneal sac or need to debride the facet and without damaging the nerve root. So in comparison, PL and 45-45 entry point, these are the steeper entry points, and thus they don't give the direct access to the epidural space, whereas TOSP and DFJ are the flatter entry points, but the risk is there is a chance of damaging viscera and the peritoneal structures. So as you can see in the figure, with the increase in weight and BMI, the posterolateral and 45-45 entry points, they tend to shift towards the midline. Thus the trajectory becomes more steeper, whereas TOSP and DFJ becomes more horizontal. So thus the entry point in TLD is not a fixed point, and it varies with the physical parameters. Thus it creates a learning difficulty for the beginners. Thus we need to have an entry point which is least variable and can be predicted. And thus, this is the radiological study where we analyze the angular trajectory of various skin entry points, and we have postulated that PL-TOSP has a least variation. This is the retrospective observational study. So in this study, we have gathered MRI FOVs of 50 patients, including abdominal perimeters. So weight, height, abdominal girth, and BMI were calculated. We included FOVs showing complete abdominal perimeters, degenerative spine pathologies with disc herniation or stenosis, and less than grade 1 listhesis. Exclusion criteria being more than grade 1 listhesis, infection, tumors, and MRI with inadequate FOVs. So we have synchronized sagittal and axial MRI images with multiplanar reconstruction mode, and measurements were done in the lower discal space, at the lower discal margin. So we have marked the discal intersection point, which is the point of posterior vertebral line and medial pedicular line. And then we mark PL and 45 entry point as per ES geometric technique, and DFJ and TOSP as per Sebastian Rutten. PL-TOSP was marked as a midpoint between PL and TOSP. So the trajectory was drawn between the respective entry points and the DIP point, and the angle of trajectory with the horizontal was measured. So we used SPSS software 23, and correlation tests were used with statistical significance with the p-value less than 0.05. So results were like this. Weight were around 71, BMI 29, and abdominal girth around 91. So as you can see in the figure, PL and TOSP, the range is between 21 to 29 degrees, which is maximum for 45 entry point from 36 to 56. So the average distance from the midline for PL-TOSP is around 13 to 14, whereas for PL it is 10, and for TOSP it is around 16. So range of distance from midline for PL-TOSP is around 8.6 to 17.6. So after the correlation coefficient were analyzed and p-value was calculated, the conventional entry points are varying statistically significantly, where p-value is less than 0.5, whereas our proposed entry point PL-TOSP does not vary that much with the physical parameters, with coefficient of variation near to 0. So it provides a fixed range of angulation in the transforaminal endoscopic spine surgery. Thus, it is the middle path between a posterolateral approach and far lateral entry points, and it retains the advantages of PL and TOSP, whereas minimizing the complication. So in conclusion, it provides a novel it's a novel entry point with a constant predictable trajectory of average angle of around 26, and it is also compatible with the endoscope of current generation, ranging from 25 to 30 degree optics. But our study lacks that clinical studies needs to be done to validate the efficacy of PL-TOSP. Thank you.